The U.S. Embassy in Freetown is primarily focusing on strengthening Sierra Leone's health system with the advocacy for good governance, respect for human rights, freedom of expression, and the rule of law appendage to it. U.S. Ambassador to Sierra Leone David Reimer says they recently honored the graduation of 35 students of the U.S. Centers for Disease Control CDC Field Epidemiology Training Program, FETP.
The CDC Field Epidemiology Training Program was established back in 1980 to train what could be called disease detectives for all over the world. The FETP program in Sierra Leone began in 2016, shortly after the West African Ebola outbreak. Since then, we've trained over 300 Sierra Leonean disease detectives. And because of this training, Sierra Leone has successfully met the global benchmark for trained epidemiologists. The impact that the trainees of this program have had on health in Sierra Leone speaks for itself. Graduates of this program lead investigations on outbreaks of diseases like Lassa fever, monkeypox, Ebola, COVID-19, and polio, just to name a few. And thanks to this program, there are trained disease detectives in all 16 districts of Sierra Leone.
In respect of the Health Alliance with Sierra Leone, the U.S. government donated test kits for monkeypox, anthrax, influenza, and training sessions for the disease detectives. Previous trainees of the program worked with counterparts to investigate the tragic food poisoning incident recently in Kenema.
FETP is just one example of how the United States is partnering with Sierra Leone on training public health officials and clinical practitioners. This year, the United States partnered with the Ministry of Agriculture to launch Sierra Leone's first veterinary epidemiology training in Sierra Leone, which will train veterinarians how to detect and respond to infectious diseases found in animals. And earlier this year, I was pleased to attend a training session for healthcare providers to more effectively diagnose and treat HIV/AIDS. This is an area that both the U.S. President's Emergency Plan for AIDS Relief, PEPFAR, and the U.S. Department of Defense have also been instrumental in addressing.
The partnership aims at helping public health officials and clinical professionals to effectively detect and respond to communicable diseases. Salifu Cherno Kamara, AYV News.